I was just thinking about your first day at Pilates. Remember how innocent you were then? You came in wanting your core strength and your rock hard abs because somebody told you that was the solution to your low back pain or a neck problem, or maybe that your hips were too tight. And then we proceeded to kind of burst your bubble by talking about breathing for half an hour, because with most of our clients, that is the first and best way to begin stepping out of pain. And then we go on to tell you that Pilates is not just about your abs, it's a full body exercise system that's really meant to retrain your nervous system so that you can rebalance all of your muscles and connective tissue to better support your spine, so you start to have effortlessly good posture and just move with ease. And at that point in your first lesson, like, we've hit saturation, we stop talking, cross our fingers, do a bunch of exercises, and then just send you into your Pilates career, knowing from our end that everything else you need to learn, you're going to pick up as you go within your understanding of the repertoire of exercises. So I wanted to hit on a couple things that we bring up and then you forget on that first day, now that it's a few months later. And these are the kind of things that we really all need to keep revisiting every few months just to remember why we're here. So there's two things I want to talk about that are about your abdominal muscles, but not the things you asked for the first day. So the first thing is about balance. Anytime I am balancing on one foot, I need to be able to coordinate or integrate, engaging all of the muscles and connective tissue along the side of the body that I'm standing on. Part of that is using this part of your abdominal wall. Some clients start Pilates and they don't realize this is part of your abdominal wall. Since we all took the same gym classes, I guess, growing up, some people only think of ab work as a sensation that they identify here in the front of the body, like you feel when you do a crunch or a sit-up. But our abdominal muscles are involved in every movement of the trunk. So in our Pilates classes, you'll notice we program a lot of side bending movements so you can begin to strengthen and build awareness of this whole region of the body working together. And we'll combine programming movements like that with exercises that then require you to use the same tissue to stabilize, like maybe resisting forces side to side, or sometimes we'll get on the ground and do something like a side plank. And that's trying to get you to build up an awareness of all the tools that you will have, not just at your abs, but in your whole body to support your abs so everybody does the right job. Okay, so the second thing, it's about rotation. We do tell you on that first day that when you're rotating your trunk, that's a job of your oblique abdominals. And they're really cool because their fibers run at diagonal angles and lots of different angles of the angles, kind of like pockets and backwards pockets, but they're covering a large area around your torso and have some involvement in all the movements of the trunk. So when we first introduce an exercise that has rotation, we try to keep it pretty simple, like keep your hips still and twist your ribs, or turn your head and look over your shoulder. And we first teach you the movement from like the big chunks that you're trying to change. But there are also all these micro rotations that are going on at joint surfaces when you're moving. And a lot of them happen in such a subtle way that you don't even perceive they're going on if your body is functioning optimally. And when you think of this, because this is not just about your abdomen, the reason for it is your bones, as you know, they're all kind of irregularly shaped to relate to each other. But when they go through a range of motion, sometimes the body requires a slight rotation of one or both of the bones that are moving so they can continue to relate to each other without extra compression or shearing or friction on them. So the weird shapes of the bones are allowed to move by each other, having a different relationship here, say, compared to there. But for that to be going on and you not to notice it, we need to have proper range of motion available at all the joints of our body. Because if one is restricted, the ones around it can often do too much motion and become hypermobile to make up for it. So when we're doing these rotations in class, we're giving you simple instructions so you have an idea to focus on, our corrections of your alignment become really important because organizing all the body parts that are moving is the best way to get you into the right muscles. So sometimes you'll notice while we're talking about twisting your ribs, you might get cues about engaging your upper back to get a little taller. And look how that just reorganizes my body. Or we might ask you to look somewhere. If your head's falling, I might tell you to spot something on the wall a little bit higher to bring your head in line with the rest of your body. So sometimes we're doing work away from your abdominal muscles to make sure you can get the rib cage and the pelvis in the right relationship to each other to feel the ab work you were asking for. So this week, when you go back to your practice, I want you to take some space. Ignore some of the cues that are like flying through the room as we talk to you really fast, and just think of the motions that I just described and witness what's going on in your body. Don't worry about what I think should happen. Take some time to feel what is going on in your body, and then you can always ask a question back to me or your other teachers. If you don't feel your abs in one of the exercises, the information you did gather will help us figure out what else we need to say to you to get you the right results. All right, that's the homework for the week. I'll see you at the studio.